This is Chapter 16, Nursing Assessment. This figure depicts the nursing process and showing that it is a critical thinking 5-step approach that professional nurses used to apply the best evidence that we can find to help deliver our nursing care. The steps of the nursing process, ADPI, are essential core of our nursing practice. So the nursing process helps us to deliver holistic patient-centered care. We also have the Quality and Safety Education for Nurses, or QSIN as it's known. It's an institute. These individuals define patient-centered care as recognizing the individual in a full partnership to provide compassionate and coordinated care based on the individual's preferences, values, and their needs. So assessment is a deliberate and systematic collection of information about our patient. It includes physiologic, psychosocial, cultural, spiritual, and different lifestyle factors. The information that we will gather during this process will help reveal the patient's both current and past health status, looks at their functional status, as well as how they cope with any problems. So our assessment actually involves 2 different steps. We collect information from our patient, which is always our primary source, and secondary sources. So you can think of family or medical records or other health professionals. Then we will actually interpret and validate the data to determine whether or not we have all the information that we need, and that way our database would be complete. So this applies the critical thinking with the assessment process. So when we are assessing our individuals, we are using our knowledge base, so our pathophysiology, our lab values, our medication. We're applying specific standards, so the way we treat our patient, right? Any type of standards within our nursing practice. We also are using the experience that we have already gathered. So we know about maybe patients' prior maybe experiences, and we're determining those with our assessment data. And then we're also looking at our attitude with our assessment process, because we need to make sure that we are using justice and equity whenever we are assessing our patients. So different assessments may be conducted throughout ongoing contact with our patients. Periodically, problem-focused assessments will be collected, maybe when we're rounding or when we administer patient care, if we're trying to do a quick screening or look at any further problems that may exist. Our physical exam, this is a problem-focused approach because it will often begin with the patient's situation and specific areas. And then we will ask patients questions to help clarify and determine our assessment material, so that way we can fully understand our patients. So understanding Miss Tompkins, what would you expect to find during her post-op assessment? So there are 2 primary types of data that we gather. We have subjective and objective. Subjective are any statements or information that the patient tells us. So for example, if I ask someone their pain level, I cannot measure that. I have no understanding. If I ask them if a medication worked, I have no way to determine that. So anything that comes from the patient is considered subjective. Objective are things that we find looking through our own eyes, whether it is lab values, whether it's something that we witness with the patient. We may witness their affect and they may be frowning, but they have a very cheerful voice. Okay, we use all of our senses whenever we're gathering objective data. So knowing that Ms. Tompkins has complained of pain, is this subjective or objective data? Remember that subjective is anything the patient verbalizes related to themselves and their health condition. Objective are observations that we as a nurse make about the patient's actual health status. So when we're talking about assessment sources, our patient is always our primary source and also is our best source. These patients, if we're going to get the best information, they have to be conscious, alert, and able to answer questions appropriately. Family members or others can provide us with information for infants and children, critical ill adults, and patients that may have different disabilities. In a state of emergency, the family members may only be our actual source of information. These individuals are also very important secondary sources of information for our patients. They can actually confirm our findings and help identify different patterns. So we will often, as nurses, frequently communicate with other members of the healthcare team when we're gathering information. In an acute care or hospital type setting, the change of shift or patient handoff is the way for nurses to communicate the most recent information about our patients to others. A medical record, this can be a great resource when we're doing our patient's assessment because it will contain history, lab and diagnostic results, current findings, and the provider's actual treatment plan. For educational and military and employment records, these will often have a lot of information about our patient. If the patient receives services at a community clinic or a different institution, remember that we as nurses will need written permission before we can actually access that record. Our experience when we care for patients is our source of information and data. Through our clinical experience, we can observe the patient's behaviors, their physical signs and symptoms. We can watch for trends and recognize any changes clinically. And it helps us to learn the questions that need to be asked and choose the questions that will provide us with the actual most useful information. This actually helps build our nurse-patient relationship. So for us to have a good relationship with our patients, we have to have effective and therapeutic communication, because this is the actual building block or the foundation. And this allows the patients to express themselves to us and for us to understand our patients and different experiences that they have. This actual communication requires skills, and also we have to be sincerely intent to understand actually what is concerning to our patient. Understanding our patient is not sufficient. We also need to make sure that our patient gets the message that we are accepting and that we are understanding. So trust is something that is vital for a good nurse-patient relationship. And it actually As nurses, we need to make sure that we're able to learn information needed for our patient and their care. Connecting with our patient when we show interest in their problems or concerns, this will assist us during our assessment process so we can get the most important information. So our patient-centered interview is empathetic. It helps strengthen the patient's self-esteem, lessens feelings of hopelessness that often will accompany an episode. Before you start your interview, you might need to make sure that you're prepared. You need to look at your patient's medical record and want to make sure that you if you have information that you're going to go in and maybe validate it. We're also thinking about the information that we've gotten during a handoff at the beginning of the shift. This will help us to address problems that we may need to explore. So for skills we use, one is courtesy. So you want to make sure you ask the patient what name they would like to be called. And you're going to introduce yourself, and you want to explain to the patient who you are and why you're here. And remember that we need to have a patient's permission before we can do any type of interview process if there's someone else in the room. Okay? We also want to provide comfort. So we want our patient to be comfortable. If they're in pain, they may have nausea or vomiting, we're not going to get a lot of information out of our patient. So we want them to be comfortable before we start our interview. We think about maintaining privacy. Okay, we want to ensure that if they have any symptoms, that we keep our questions as short as possible and focused. We want to build a good first impression. So taking in a computer screen and staring at the computer screen is not going to show your patient that you have empathy and that you're a caring individual. We want to make sure that we're not too stiff or put off, and yet we don't want to be too casual, okay? Because we are taking and putting our best personal, professional nursing self in to meet this patient. So think of your word professionalism whenever you are going in to do an interview. We want to make sure that we use open-ended questions. Okay, you don't want any of those yes or no type questions. Those are considered close-ended. They don't give you much information. Patient's going to answer your question and then be done. And they're not going to tell you anymore, and then you're going to need to ask a follow-up question. So learning how to ask open-ended questions is extremely important. So when we're done with our interview, we want to make sure that we summarize what we have gathered from our patient and make sure that the patient clarifies. So you can say to your patient, maybe, is there something else you might like to talk about? You know, if the patient has questions that cannot be answered, you tell the patient that, and you promise to return with some sort of information at a later time. So our actual patient-centered interview is a formal process, and it's for the purpose of collecting a nursing history. We will actually go through 3 actual traditional phases. So we have an orientation phase, we have a working phase where we're actually collecting information, and then we have the termination phase where we are have completed our interview. So the techniques we use when we're actually interviewing our patient, observation, keen observation, and silence oftentimes are good ways to gather information. We want to make sure that the questions we ask are stated as open-ended, so that allows our patient to talk feel like they can talk freely and provide us with as a vital source of information. The only time we may need to ask close-ended or explicitly direct questions if we're trying to get information related to a specific situation or a problem. Leading questions, these are questions that are hopefully going to open up the conversation for your patient to just explain things to you. Back channeling is considered a way to reinforce the nurse's interest in what the patient has to say through the use of eye contact and active listening. Sometimes back channeling, you may hear the nurse say, yes, oh, okay, please go on. Okay, that's back channeling. Probing will help us gather more information. So probing can be a statement like, is there anything else you want to tell me? We're always going to interpret, but we need to make sure that we clarify the information that we've got and that we interpret it correctly through the patient's eyes. So when we're in the termination phase of the interview, we are summarizing everything that we've talked about with our patient. This is where we clarify, validate, we look to see if the information is accurate. Right? We're going to maybe 5 minutes before we're going to finish our interview process, you may say to the patient, well, I just have a couple more questions and we'll be finished in just a couple minutes. All right, this may help the patient stay focused because they could be sitting there asking in their mind, oh my gosh, how long is this going to take? How long is this nurse going to be in my room? So for us to gather a health history, this means we have to be culturally competent. So as a nurse, this for us involves self-awareness. So we're looking inside. It also involves our reflective practice and our knowledge of the patient's core cultural background. So we need to make sure that when we're doing our assessment, we are adapting it to the actual uniqueness of our patient. For us, cultural humility, this permits us to recognize our own limitations and our own perspective and allows us to be open to new thought processes. So reflection in our practice is vital to help us become culturally competent. And we realize as nurses, we can't know everything, therefore we don't know everything. And we recognize this humility within our professional selves. We just want to make sure that we're very considerate of our patients and be very, use keen observation skills so that way you can see if something might be offending your patient and you're not even realizing it. A patient is admitted to the hospital with shortness of breath. As the nurse assesses this patient, the nurse is using the process of evaluation, data collection, problem identification, or testing a hypothesis. The answer is B. Assessment is our first stage of the nursing process, and this is the process of when we're gathering data. So then we can go ahead and formulate a nursing diagnosis, and then we can work on our nursing care plan. As a nurse, we need to make sure that we use professionalism and a caring approach when we are interacting with our patients. So we want to make sure that we're actually looking at our patient, right? Face to face. The computer screen should be sitting off to the side. You do not want it to be in the eyesight or in the line sight of your patient. We need to be focusing on the patient, not on the computer, because your computer is a task and you want your patient to realize that their you're there for them and they're the center of your thought process at the given moment. So when we're doing our interview process, we're also using our critical thinking, and we're thinking of the acronym PQRST. This helps guide our assessment. So if our patient has a concern, we can ask them, so P would be provokes, any precipitating or relieving factors. Okay, so if it's a situation, how did this begin for your patient? What may make it better? What may make it worse? Q is quality. So you want to know, what does it feel like to them, right? We want to figure out how they describe it. So if it's pain, is it sharp? Is it dull? The R is radiate. So where does this issue start? Where's it at? Does it stay there? Does it move? Okay, we want our patients to be as informative as possible so we can gather a great understanding. The S is severity. So I can't judge a patient's pain. I have to have the patient judge their own pain, and we use a scale of 0 to 10, with 0 being no symptoms, and then 10 is the worst pain the person can potentially imagine. And then T is our time. So we want to know when this starts. How long does it last? Okay, does it come and go? So we always want to make sure that we record our results, and our recording should be clear and concise, and we use medical terminology. This information is the baseline to help us determine the patient's nursing diagnosis as well as health problems. This information helps us plan and implement their care, and then this information will help us evaluate the patient responses to the interventions. So we want to make sure that it is timely, it is clear, and it is concise, all the information that we have gathered. A basic rule in nursing documentation of an assessment is to record every observation succinctly, or one after the other. When we are making our documentation, we want to use facts and be very descriptive. We report on things we may hear, see, feel, or smell, using appropriate medical terminology. Think about when we ask the patient to describe their pain or show where their pain is located, how this helps to address the nature of the pain. Also, when we ask our patients about pain during certain times or periods of the day, or maybe when they're moving. Okay, severity of pain, remember, is addressed by a pain scale. The nursing process organizes your approach to delivering nursing care. To provide care to your patients, you will need to incorporate nursing process and decision-making, problem-solving, interview process, intellectual standards. So the answer is C. The interview process is an integral part of the patient-centered care. It is continuous throughout the patient interaction, irregardless of the stage of the nursing process. Is Yolanda's thought process correct that the surgeon is going to be the best source of information? So our assessment process, we support any subjective findings with objective information. So remember, subjective are what the patient tells you. Objective are information that you gather through using your 5 senses. Okay. This helps us. We want to make sure we use all the senses when we gather data. So we will interpret our assessment data to determine whether or not there is anything abnormal. Okay, so this is why as nurses we need to know what standards or normal values are. Clinical reasoning will allow a nurse to recognize potentially that further observations might be needed to clarify information, and then to help begin to identify the patient's health problem. A cue is information that we obtain through using our senses. Cues that we gather are signs and symptoms that are found during observation and measurement. We actually will cluster this information or these cues that relate together. Then we will make inferences and we will look for different patterns. A clinical inference is part of the clinical decision-making process, and it occurs before we determine what the patient's actual problems are. It is our nursing interpretation of the cues that we have found. So as a nurse, we'll see patterns in patient signs and symptoms, and we will confirm a pattern by maybe adding more information, or we may determine it's not a pattern based on a different assessment finding. To assess our patients well, we need to critically anticipate. So we're always trying to think about what the data is that we've gathered, what it means, what it is telling us, and we need to understand if we should further investigate to gather more data. So the nurse notes in here that the patient looks uncomfortable and the patient has discomfort within their surgical site. So the cues that the nurse is finding is the patient will lie still with the arms tense along the sides, states they haven't flipped over for some time, and that they report a 7 on a pain scale of 0 to 10. So the nurse is going to infer or come up with the conclusion that their pain is severe and that their pain will limit their ability to actually move so they can actually reposition themselves. So our thought process, our inferences will help us guide us to more questions for our patient. So once we ask our patient a question or we make an observation, these patterns form, and then the information will branch off to additional questions or observations. By us knowing how to probe and frame questions, this is an assessment skill that will actually grow with experience. Okay, as a nurse, you will learn to decide what questions are relevant and that need to be asked so we can make sure that we have an accurate data interpretation. So a concept map is a visual picture that allows a student or a nurse to graphically show connections between the patient's different health problems. It is a strategy to help develop critical thinking skills by helping someone that is learning understand the relationship that exists among different patient problems. By placing all of the cues together in clusters, this forms patterns, and then this will lead the nurse to the next step of the nursing process, which is now nursing diagnosis.